Good morning. My name is Arlene Inoue, UTLA Secretary and Bargaining Co-Chair. Today, we will share the latest science, the trends, and guidance around safe and strong schools. We are joined by panelist Dr. Bob Harrison, a doctor of occupational and environmental medicine, Carla Garcia, an LAUSD parent, and our moderator, Laura Curry of the Center for Organizing and Bargaining at CTA. Dr. Bob Harrison established the UCSF Occupational Health Services, where he has diagnosed and treated thousands of work and environmental injuries and illnesses. He's led many work and environmental investigations of diseases. Dr. Bob Harrison is currently the director of the NIOSH-funded Occupational Health Internship Program and associate director of the UCSF Occupational and Environmental Medicine Residency Program. Laura Curry, who received her MA in Public Health from UC Berkeley, has led occupational health and safety programs for hospital and nursing home workers. And our parent, Carla Garcia, has a fourth grade student at Palms Elementary. She is vice president of her school site council and is active in Reclaim Our Schools LA. We are so glad you are joining us for this critical conversation and discussion, with safety being the top priority for UTLA. It's been 8 months since COVID-19 global pandemic shut down our schools in Los Angeles. Many of us today have pandemic fatigue, but the virus is real and more deadly than when it first hit us. Many families are struggling with economic insecurity, with being teachers to their children, teachers' assistants for the first time, and having emotional trauma. I'm glad that Carla is with us to share her story. Our UTLA members miss so much being with their students, with their school communities, and our members are working harder than they ever have with distance learning. There's apprehension and anxiety. We all know that there's no quick fix for COVID-19. There's no good solutions in providing public education to our students. We heard the news yesterday, the interview with Vice President Jackie Goldberg and School Board President Richard Vladovic, sharing that it is not likely that the health metrics support resuming schools in January. We agree with them and think that it's illogical to think about opening schools earlier, knowing the schedules of students and the changes that are going to happen that will be in the cold and flu season. And while parents are struggling with distance learning right now, they care more about the safety of their students than a rush to open. So we agree, and we think the superintendent also agrees. And we think it's not surprising that both Dr. Vladovic and Jackie Goldberg are educators themselves, teachers and administrators who understand the complexities of teaching and of running a school system. So when will it be safe for the eventual return to physical schools along with an online option? How do we avoid the yo-yo effect, the opening and sudden shutdown of schools? What are the metrics for a safe return? How vulnerable are our students, from the littlest, the youngest? We have from 2 years old to young adults. What are the unique challenges we face in Los Angeles, where we remain in the tier with the highest positivity rate and as the second largest school district in the nation, with disproportionately impacted low-income students of color? We're going to tackle all these questions and more, and I'm so glad that we have a panel here to talk about this today. So I'm going to introduce now our moderator, Laura Curry, who will walk us through these questions. Please be sure to write your comments and questions below in the box, and we look forward to answering them in our FAQ, utla.net, where we answer questions weekly and update weekly the questions that members have. So now, let me go to Laura.
Thanks, Arlene. Welcome, Dr. Harrison. I'm so glad you're able to be with us today. So I'm hoping that you can help us make sense of the COVID-19 trends we're seeing in California and across the country. As Arlene shared, LA County, we still face a widespread level of transmission risk, remaining in the state's highest purple tier. And in California, we seem to be on the other side of the late July peak, but now it seems like the statewide numbers are beginning to creep up little by little. The state's health department on Monday reminded the public that as case numbers continue to rise in California, the total number of individuals who have serious outcomes will also increase. And we've already lost 17,400 people, loved ones, neighbors, Californians. We also really need to be clear-eyed of the reality that families of color are facing during this pandemic, as Arlene mentioned. Nationally, we know that 1/3 of Black Americans personally know someone who's died of COVID-19. Here in California, the Latino community and Pacific Islander community has been hard hit, facing disproportionate cases. And last month, the CDC released a report of pediatric COVID-19 fatalities, which found that 78% of the deaths were among Latinx, Black, and Indigenous children and teens. So we see this convergence of COVID, racism, and poverty, and it can't be overlooked in California, in LA, and across our country. And our advocates, we've demanded that we remove those systemic barriers and we really invest in health equity. And we sit here in California kind of with these trends, and we look around to other states and the virus is spreading quite quickly. I was really overwhelmed last night reading an article from a nurse in Milwaukee, Wisconsin. And she was fighting back tears, and a patient of hers had just passed. And her quote was, "Those moments, they hit the soul." So Dr. Harrison, help us interpret this movement that we see with this virus, what we should be looking for, particularly in this season where we're about to enter a cold and flu season and the fall and winter holidays. Your thoughts?
Thanks, Laura, and so good to be with you. I also heard that interview last night, and I was personally very moved by what that nurse said about losing one of her patients. I think many of us have either known friends or family members or within our extended circle of people who either have been sick or have been hospitalized or have died of COVID. This virus is still with us, and it's going to be with us for many more months through the vaccine and beyond the vaccine. And what you said is absolutely correct, that this virus, because it's with us, affects everyone, but it doesn't affect everyone in the same proportion. So communities of color, frontline essential workers, are disproportionately impacted by COVID-19. In schools and children, as communities that gather together under one roof, there's an absolutely unique intersection between the rates in the community and the rates in our schools. And as we head into the fall season and the flu season, the season when children get sniffles, fevers, they get sick, adult members of the community and the school community have the same symptoms, we absolutely have to be on the lookout for the resurgence of COVID in California, with special attention on the schools if and when we slowly reopen in a phased way. California, you're absolutely right, Laura, has been in much better shape than many other states. I think there are now more than 40 states with increasing numbers, hospitalization and deaths, particularly in the Midwest and West. So we absolutely have to continue to be vigilant in California to make sure that we're not seeing the same trend. I agree that we're seeing a slight uptick now, which I think puts us, again, on guard to realize that this virus remains with us, and all the layers of protection, which we'll get to, need to remain in place.
Thanks. So, as Arlene also started us with this COVID fatigue, and I almost feel like there is this fatalism brewing, that the sickness and death from COVID is just inevitable. And we even hear some officials just throwing up their hands and just plainly giving up on protecting the safety and well-being of our communities. My public health training has shown me that with preparedness and a really well-organized and well-run full court press, we can get ahead of a virus and other pathogens. And some other countries have been a bit more successful than we have of getting this virus under control. So thinking about that, what are the things that, broadly in our communities and public health can and should be done to really get control of this virus and put us onto a path of community safety and well-being?
Well, first of all, as a doctor and somebody who works in public health, I never give up. And I never will give up, whether it's my patient or the community or making sure that schools are safe. So let me first respond to the comment that you mentioned to me. I think that's a recipe for disaster. Other countries have had many other very effective practices. And what we've seen in those other countries are very widespread capacity for case contact tracing when we have a positive, to follow up immediately, to trace all the contacts, to quarantine, to test. Widespread and available testing capacity. So testing is also another cornerstone of effective control. Putting into place all the layers of prevention, workplace precautions in those other countries with the best work practices, having protections for income loss. One of the things that I've seen many times with my patients and with workplaces and workers has been, well, why should I go get a test if you're just going to tell me I have to go home for 2 weeks? And I might lose my income. And then you're telling me I have to file a workers' compensation claim. Well, that's a hassle, and I don't want to make waves, and I don't want to get into trouble. So when we have those systems in place so that we can keep the income going and encourage reporting and symptoms and go get a test, then we have a much more effective way of controlling COVID in the community and the workplace.
Those are great points about what we need to do broadly in society. So thinking about kids, like I have a high schooler. We're going to hear from Carla, who has a 4th grader. I know you have young grandchildren. Many of our listeners are parents, caregivers, educators. Children are at the heart and soul of our lives and what we do. So I want to talk a little bit about COVID in children. We have seen in California, kind of in the last few months, that the percent increase among 0 to 17-year-olds has been larger than the other age groups reported by the state. Some counties have even reported double-digit test positivity numbers among those under 18, more than other groups. And we saw that in a CDC study that when test positivity rates of children, teens, and young adults start to spike, that's often putting us on notice that a hotspot is brewing. But we've heard a lot about kids and COVID. Can they get it? Can they transmit it? So can you share a little bit with us about COVID, children, those under 18, are they able to become infected? Can they transmit it to others? Some of the health consequences, and if there's some children that are at greater risk for severe disease, similar to those of us who may be in high risk groups as adults.
Children become infected with COVID. Laura, when you ask about, I think, under 18, I think there's a gradient. The data suggests that high school students are probably more likely to become infected and to transmit COVID among their peers and to staff in schools than our children in the younger age groups, in the elementary schools. Junior high schools, I don't know where to put junior high school students data-wise. I think junior high school students are probably going to be closer to the risk of infection to high school students than they are to elementary school students. And I say that just having had my own two children, and I see that their behavior in junior high is sort of, one day they're acting like they're 5 and the other day they're acting like they're cool 18-year-olds. And when they're acting like cool 18-year-olds, that's when I worry. That's when I would have worried about their transmission of COVID. So all children can get infected. There's probably a gradient. I think there's probably, the evidence shows that elementary school children are less risk. They're not zero risk. We see that over and over again. And in the data and in the outbreaks in childcare centers this past summer, data from Texas and some other states. I have a 2-year-old grandson. He's in daycare. His childcare worker had symptoms, was tested as positive. He just came home for 2 weeks because they had to take not only his pot of children, but he spends an hour and a half with the children in the other classroom. So basically half the school is closed. So fortunately he did not become infected, but he was at risk of infection. And he had a few sniffles. He got a test and was fortunately negative. It's when you say the age cutoff of 18, Laura, it is very clear that we've had over 1,000 different colleges and universities with 18 to 22-year-olds with tens of thousands of infections across the country. And I have no reason to think that high schools would not be that different. Maybe a little bit less, because in colleges there are congregate, there are dormitories where kids are living. They're beyond the drinking age when they're off in college. But I think there's going to be this gradient. There are children that are more susceptible to COVID infection, children with underlying medical conditions who are immunocompromised, children with heart and lung problems, or children with disabilities who are in the schools. They are going to be, if they become infected, probably more susceptible. And of course, we know that there's this delayed severe inflammatory systemic illness after children are infected. It's fortunately rare, but it occurs in numbers that are now ranging in the 3-figure, in the hundreds nationwide.
Wow, thank you. So let's talk a little bit about schools. So as Arlene said, LAUSD, second largest school district in our country. Here in California, we have 600,000 school employees who serve over 6 million public school students. So if we think about that, each of those students and staff members lives with a couple of folks, parents, grandparents, caregivers, siblings, spouses. They leave school and touch the lives of at least 20 million people. So that's half of California's residents. So we always like to say schools are the heart of the community. I think the numbers right now are pretty crystal clear on that. And LAUSD faces a unique challenge where 90% of students are in poverty. Families may be more at risk for severe illness and death from COVID-19. So I want to think about what we need to look for in schools. I've read a Harvard report that uses an analogy of we need a layered defense against the virus. We've heard that from other public health experts about this multi-layered approach, that no one single measure is going to be the quick fix. Given the equity issues, how do we make sure that no matter where a family lives, that they can rest assured that their child's school has a complete set of safety measures in place? And what are the things that school families and educators should be looking for in their school district's prevention plan?
So thank you for the question. It's a great question. I love the analogy to layers, because when I think about layers, I think of my grandmother who took me to this bakery in the Bronx. And my favorite chocolate cake was this chocolate layer cake that had 10 layers to it. And when I took my fork through that chocolate cake, I went through all those layers, Laura. So layer cake happens to be, particularly that thin chocolate layer, one of my favorites. So I think of COVID in the same way. I think of all these layers are necessary in that cake, right? I'm not going to take any of them out. And if you ask me which of those layers of that chocolate cake is more important than the other, I say they would be all important, because I don't think that there's any data that any one is more or less than the other. And those layers include, first of all, keeping groups small. And by the way, I would say that what applies to the community, I just take over and apply to the school setting, because the school is a form of a large community. So what we're recommending to all of us in terms of our prevention measures for COVID applies to the schools. So that includes keeping groups small. And this is just simply a matter of the smaller the numbers, the less likelihood that somebody will become infected in that group or is infected in that group. And the distance, which is the second layer, keeping a certain distance apart. COVID is transmitted through the air and by surfaces. And through the air, the tiny particles can remain airborne for relatively long periods of time. Can be an hour or two, depending on the room circulation. And so the further the distance, the less likely is that infectious dose, the amount of particles that are going to be in the air. The third layer are face coverings, masks. There's some pretty good data in many areas of the world. Some recent data that I heard about yesterday, a natural experiment in one of our Midwestern states that showed that the rate of COVID infection significantly was less when those counties had a universal mask mandate. The fourth layer is ventilation. Ventilation decreases the amount of virus in the air. Adequate filters on the school ventilation system, enough air changes in the room, portable HEPA filters, if it's possible, keeping that window open. Another layer is testing, and there are 2 or 3 different methods for testing or reasons to test. One is that when somebody has a symptom and is coming to school, whether that be a staff or a teacher, getting that immediate COVID test done. Another is if there's an outbreak in a school, having a rapid system for finding everybody who is a contact, testing those people, quarantining them, sending them home for 2 weeks if needed. And the third is what I call testing for prevention, or ongoing testing, frequent testing, so that as we reopen schools slowly, we can really see whether there's a risk over time. And those are the big layers. There are a few others that we can talk about with questions maybe, but those are the main prevention points.
Mm-hmm. So Dr. Harrison, you mentioned small groups, which is the advice we're getting, in the general community. Can you also talk, we hear a lot about small and stable cohorts. What does that mean and how does that work with prevention?
Well, small and stable cohorts mean that if there should be an infection either in a student or a staff, that the tracing or the identification of who is exposed can be limited to that small and stable cohort. That may mean that the children have to be sent home for 2 weeks, quarantine along with the staff. But if they didn't have contact with other groups or pods within the school, then those other pods or groups can remain going. They can remain together in the school. So it's a method of not having to close down entire schools because there's all this mixing within the school environment.
And can you share a little bit more around the airborne transmission? That was kind of breaking news from the CDC earlier this month. We have had air scientists kind of sound that alarm bell for many months now of concern around the virus in the air. Can you tell us a little bit about this kind of latest update in transmission science?
If someone's infected with COVID, they're carrying a certain amount of infectious virus in their airways, in their mouth, their back of their throat, down in their lungs. And as that infected person speaks, coughs, sings, yells, sneezes, those particles are emitted. And as they're emitted from the mouth, they're in different sizes. Some are big and drop to the floor within a foot or two right away. Some become very tiny. As the air evaporates around the viral particles, they can remain in the air and spread in the space that the infected person is in, which is why if we're outdoors, the risk of infection is lower than if we're indoors, right? Because the virus is going to circulate in the outdoor space. And that can be transmitted over several feet. We've heard from the CDC and public health officials, the 6-foot rule, right? And the 6-foot rule comes from the distance that those viral particles can transmit. In fact, they can probably go more than 6 feet, but we kind of use the 6 feet as a good rule of thumb.
So all these layers in the cake, how, when schools open, there's day 1, but then there's day 2 and month 2 and month 3. What's important to look for to make sure all of those layers are maintained within a school site setting and within a district? Kind of thinking programmatically from your experience in occupational, environmental, health and safety, how do you keep those layers strong day in and day out?
Well, in a workplace, it starts with having a plan. First of all, thinking that this is important and that there should be a plan. And that is probably a written plan, right? So everybody can see it and discuss. It's very important that workers and their representatives, frontline teachers and staff, are engaged and participate in the formulation of that plan with principals, school districts, managers, local public health officials. And that is, a very, very important principle, that the extent to which we're all in this together and all are going to commit to following those safety principles is really what I call a safety culture, a culture of caring, that we're all in this together, because that's the truth in a school community. Then once that plan is in place, the devil is then in the details. Who actually implements that plan? Designating a responsible person or people who are going to be implementing aspects of that plan. Identifying who's going to be engaged. I'll just give you a simple example. I get questions about ventilation systems. Well, I remember in junior high school, there was the school custodian or janitor. Loved him. He did everything. He could fix a doorknob, and he was the guy that jiggered the ventilation system. that person may or may not be the person to know how to get enough airflow into a classroom. So there might need to be a specialist who comes in and figures that school ventilation system out. And then finally is evaluating over time whether, if these safety measures are in place, are they working? And we have a way to do that, and that's called a COVID test.
So speaking of testing, LAUSD is building the biggest COVID virus testing and tracing program in the country. And so why is that so essential? And what does the role of a school-centered COVID testing and tracing program play in keeping schools safe and keeping our communities healthy and safe?
Well, as schools, if and when schools reopen, and these safety measures, these layers are in place, the question is, how do we know that they're working? About 50% of all COVID infections do not have any symptoms. So if we were to just rely on a symptom to test students and staff, we'd be missing about half the cases that occurred in schools. So the question is, how do we know that all this is actually working? And that's where monitoring with testing comes in. Because if we were to do intensive testing by some strategy, and I appreciate what the plans are in Los Angeles County, for example, because it's one of the leaders in thinking about how to do ongoing testing. If we can get that data as we head into the fall or winter, or as we reopen schools, then we'll be able to really assess together, have we been able to reopen schools safely? Does the testing data show that all these different layers are working?
Well, that's so helpful, and it's so encouraging, and we appreciate you sharing your medical knowledge, your experience, and I hope you'll come back and join us for kind of a future Facebook Live and webinar as we continue to kind of move through this pandemic and make sure that together, I appreciate that we're in this together, and how do we all work together to ensure that our schools are safe and our communities are healthy. So thanks so much, Dr. Harrison, and we appreciate you being with us today.
Thanks so much for the chance to talk to you.
Well, that was great to hear from Dr. Harrison. Now I'd like to bring Carla into the conversation to give us her take as a parent and share with us her experiences during this pandemic. So we're 8 months into this crisis. How's your family doing with distance learning?
Oh, thank you so much for asking, Laura, and what an honor it is to be on this panel. Thank you for including me in this. Thank you so much. We're hanging in there, but honestly, it's very tough. We're together in a one-bedroom apartment, and there's no freedom as a parent, as a woman at all. I constantly need to be listening and monitoring my fourth grader to make sure he's not getting overstimulated with all his time on the computers. And it's a lot of work, but I'm truly believe that distance learning is the best option for now. The work is worth it.
Mm-hmm. Yeah, let's give it up to all the caregivers and take a moment to really honor that work that so many parents, caregivers, aunts and uncles, grandparents have really done in this moment. I think that's important for us to remember. So have there been some bright lights and some interesting kind of things that have happened with distance learning that have surprised you?
Well, absolutely. It began last spring, and when we began last spring, my son's classroom was a breakfast tray and on my bed. And now we've able to have the time to adjust and get him a classroom setting in his bedroom, a desk. And he actually loves his class. He looks forward to going to school and being with his classmates. So that part is a definite positive. And we're also so fortunate to have such amazing, dedicated teachers that have been so loving and caring and devoted. That culture of care that Dr. Bob talked about is in the kids' classroom. And they took a week off. They had a tech-free week so that they were able to explore their imaginations and build catapults. Yes, yes. So the teachers are doing everything they can to make this as a comfortable, and I don't want to use the normal, but effective situation. The kids are learning throughout this crisis, and that's a huge testament to the passion and dedication of the teachers.
And this is really a moment where, you know, it does take a village, and it is taking a village. But that is so great. I would love to see the catapult. That sounds fantastic. So what are you thinking? You know, you're a leader in your school site council, parent of a fourth grader. What are you thinking right now about schools reopening? What are your thoughts?
Well, I couldn't agree with Dr. Bob more. We're just not ready to open right now. You know, most of the parents I talk to at my school agree. We really want the case levels to go down before we have the kids in the classrooms. And we really, really know that we need comprehensive virus testing and tracing in place before we can send our kids back to school.
And, you know, we've seen in some districts across the country, they've opened and then they've shut and they've had to reopen. And there's kind of been this, yo-yo effect, kind of a back and forth. Are you concerned about that? What are your thoughts on kind of that dynamic that we've seen in other places?
Oh, absolutely. That's a huge concern. You know, as you said, it hasn't worked out so well. So I know that opening and then closing again would be the worst thing possible for my child and for so many parents and children. We've already sacrificed so much in these last 8 months with our time and our efforts. Why have we been doing that if we're going to chuck it all out the window and go back too soon? It doesn't make sense.
So Carla, we heard about a pretty phenomenal catapult. It is part of the distance learning program. We have a special guest who is joining us right now. You want to introduce our special guest?
I would. This is my fourth grader at Palms Elementary in Miss Carsey's class. This is Alessandra Garcia Greco.
Awesome, welcome. I see a little catapult there. Can we see how it works? Tell us about it.
You can put like something in it. I'm gonna use this little cotton ball. And then you have to, it's better if you put it on the floor, but you won't really be able to see it. So you launch it back onto the popsicle stick end.
Ta-da!
Excellent engineering design. I love it. I love it. Well, we were just talking to your mom about all of the distance learning. So thanks so much for joining us and sharing that great experiment.
Thank you.
Thank you.
Bye-bye. Say bye-bye.
Bye.
Bye. Go do something.
That's great, Carla. Thanks so much for introducing all of us to your son. So when we think about schools opening, we've seen, schools open and we've seen them close again, and that yo-yo effect. What are your thoughts as a parent about that kind of on and off dynamic of schools opening and closing?
Oh, thank you so much for that question, Laura. I just think it's a really, really bad idea. It would really be the worst. You know, that kid you just met, as you can tell, he's been such a trooper during this situation, and we've sacrificed so much to stay safe. You know, he hasn't had contact with any of his friends or his teacher. We're doing this all socially distance. And why are we doing this? Why are we making this sacrifice? And why have we been making this sacrifice for so long if we're just going to throw it all out the window and reopen way too early?
If you were, if you were talking to decision makers in our community who oversee our health or schools, what would you want them to know as a parent? And what would you want them to know and be able and do?
Oh, thank you. I would ask them to please listen to the experts like Dr. Bob. Keep up the food services, keep up what you're doing. But as Dr. Bob said, we must maintain vigilance. We cannot, for any reason, give up. There's been no reason to give up what we're doing. We have to, and I know my fellow parents agree, we want our children, of course we want our children to go back to school, but the most important thing is the safety of our children and the safety of our communities. So I just ask them to keep all that is being said at the forefront of their minds, to protect us, to work to protect us. That's what they're there for. Let's do it.
And what would you say to fellow parents as, a parent leader at your site and, in your community? What would you say to other parents who are feeling weary and tired and frustrated right now?
It's hard, but don't forget to laugh, and don't forget to look for those moments in your day that make you smile and that make you realize that you're doing the right thing, keeping your child home right now. Always, no, I mean, especially as women, we've given up so much, and we do this because we love, and we love with all of our hearts. So I'm just asking those who are in positions of power to try as close as they can to show as much love to our kids as we parents are able to give them. All I need is a drop, and that'll get us far.
Well, thanks so much for being with us here today, Carla. It was great to hear from you. So wonderful to meet you and your family. So thanks so much. We appreciate it. We're now going to go back to Arlene, where we started the program, and hear from her about what's happening with bargaining and making sure we're also supporting our most vulnerable students. So thank you so much, Carla, for being with us here today.
The pleasure was all mine. Thank you so much. Such a pleasure to meet you. Thank you.
Take care.
Bye-bye.
We're now going to hear back again from Arlene. Hi, Arlene. It's great to see you.
Hi, Laura.
So tell us a little bit about what LA is doing to support vulnerable students.
Yes, thank you so much, Laura. UTLA is committed to equity and our most vulnerable students. We know that families across LA face a lot of different barriers, and we're the ones, frankly, really fighting to save their lives. As you stated, it's been clearly documented that certain communities, low income, Black, Latinx, Pacific Islander, we have a large proportion in LA, essential workers, and students with intellectual and developmental disabilities have been disproportionately impacted by COVID-19 in terms of higher rates of infection, hospitalizations, and deaths. And this is our LA community. So we're at the table negotiating. No decisions have been made, but we're constantly thinking about our most vulnerable students when we try to find a way to safely reopen schools. But it's tricky. And one example is we have medically fragile students. We also have 30,000 foster and homeless students in LA. So just a myriad of issues and reasons for why we need some time to reopen schools to make sure that these needs are addressed.
Oh, you know, the UTLA is currently bargaining on the safe reopening of schools. I can imagine just from what you've laid out that that must be a very serious and thoughtful discussion around a pathway to safety for students and staff in our communities. Can you share a little bit with us today about that?
Yes, absolutely. I want to just start out by saying 88% of the 13,000 UTLA members who recently filled out a survey said they prefer to continue distance learning until the virus is under control. So that's 88%. And again, there's a lot of anxiety about the eventual return to schools because of all the factors that we are raising in this panel. So we've been meeting with the district for the past weeks, UTLA and LAUSD, to negotiate under what conditions would be the safe reopening of schools. Conditions that would avoid the yo-yo effect that we've been talking about. And, you know, really, in reality, schools really need federal, state, and local governments to work together to prioritize suppressing the COVID-19. And that is by funding robust testing, tracing, but also infection control practices, especially in our impacted communities. So it is not just a school problem, as we know, it is a global pandemic that touches all of us and leaves us with really no good choices, and all are responsible for safety. And I appreciate Dr. Bob's bringing in that safe community. At UTLA, you know, our bargaining team, our board of directors, our officers, all of our staff, we are committed to the families, the members, and the students of LA Unified. And we're in the midst of growing pressure too, to reopen schools for political and economic interests, but we are not wavering. We are using science-based standards as our guide for physically reopening schools. And once they reopen, we want to make sure that they continue to remain open. So it's not, we don't have the answer yet of what that is going to look like. We are researching and looking at all alternatives, all possibilities, all the issues, so that we can try to open up safely and keep open.
Well, thank you for that update, Arlene. It was a pleasure to be with you today and to be with all of our other panelists. So thanks so much for having me, and it was great to be here with you today.
So we will continue this series and dialogue because I know we're going to need updates on this COVID-19 pandemic and LA Unified. So again, our big thanks to Laura Curry, our moderator, parent Carla Garcia, Dr. Bob Harrison for this important information, and a big thanks to our ASL interpreters, Rory, thank you, Rory, and Jamila.